So it's still active. It's still
Okay,
good.
we're back on. I told you we'd be right back. We've got a committee discussion coming up on Thursday on S-189, and I thought it would be helpful since we had this time and we had Ledge Council with us, that Jen walk us through the bill again so that all the committee members can kind of have thoughts and formulate their own thoughts over the next couple of days for when we have committee discussions, so we can have a good, robust committee discussion and everybody understands. And Jen's also going to walk us through current statute, which is what we're amending. Okay, thank you so much.
Sure. Again, for the record, Jen Carby, Office of Legislative Counsel. So I will start by putting up current law. So this is 18 VSA 9456. This is part of the Green Mountain Care Board Hospital budget review process. And in subdivision E2, it says, so we'll start here with 2A, except as provided in subdivision D, a hospital that proposes to reduce or eliminate any service in order to comply with a budget established under this section shall provide a notice of intent to the board, the Agency of Human Services, Office of the Healthcare Advocate, and the members of the General Assembly who represent the hospital service area, not less than 45 days prior to the proposed reduction or elimination. This notice must explain the rationale for the proposed reduction or elimination and describe how it is consistent with the statewide healthcare delivery strategic plan once established and the hospital's most recent community health needs assessment conducted pursuant to state and federal law. Then it allows the board, says the board may evaluate the proposed reduction or elimination for consistency with the statewide healthcare delivery strategic plan once established and the community health needs assessment, and may modify the hospital's budget or take such additional actions as the board deems appropriate to preserve access to necessary services. Remember at the beginning, it said except as provided in subdivision D. Subdivision D says a service that has been identified for reduction or elimination in connection with the transformation efforts by the board and the Agency of Human Services from Act 167 does not need to go through this process. So this is the existing process. Hospital that is proposing to reduce or eliminate a service to comply with a budget order has to provide a notice of intent, giving the rationale and how it's consistent with certain required plans, and allowing the board, but not requiring it, to evaluate the proposal and take additional, and modify the budget or take additional actions that the board deems necessary.
Go ahead, Leslie.
So the risk of being a harpy, this obviously only applies to hospitals.
Yes.
In my community, the FQHC removed primary care, but they would not be required to give any notice in this statute.
Right.
Might there be an opportunity in 189 to expand it beyond hospitals, to include organizations like FQHC's providing primary care to the community, or is that beyond?
Well, remember, she's just reading us.
No, I get that. This is statute, but this, I don't believe that 189 changes that it's just hospitals.
Yeah.
And what I'm asking is, could it be possible, given that
Well,
experience?
let's have her, after she finishes here, let's have her walk through 189. And then these are all wonderful, fantastic thoughts to be thinking about for our committee discussion on Thursday.
Thinking.
Okay.
She's are federally. Person.
Well, I get that, but does that mean that they're not going to notify the community when you're walking away?
All right, so now we are looking at S-189. We are looking at as passed by the Senate. So, as a threshold matter, I'm going to take you deeper into this just to show you that that language that we just walked through gets struck. So that's a piece of, this is instead of what that language we just walked through. All of that A, B, C, D gets struck through and replaced with other stuff. Here's the other stuff. So it's an act relating to establishing a process for reducing or eliminating hospital services. It starts out with a new section being added in Title 18 on hospital service reductions with notice required. And this requires that a hospital that proposes to intentionally reduce or eliminate any service must first provide a notice of intent to the same parties as in the other one, I think slightly different order, Agency of Human Services, Green Mountain Care Board, Office of Healthcare Advocate, and the legislators representing the hospital service area. This has not less than 60 days rather than 45 days prior to the proposed reduction or elimination. It still requires that the notice explain the rationale for the proposed reduction or elimination and describe how it is consistent with the statewide healthcare delivery strategic plan once established and the hospital's most recent community health needs assessment. Then this is new. It must post the notice of intent on the hospital's website beginning on or before the day on which the notice is provided, or subdivision 1, and publish the notice in a newspaper of general circulation in the hospital service area within 10 days after providing notice under subdivision 1, and conduct a public engagement process, including holding at least one public hearing in the county in which the hospital is located and soliciting and responding to public comments regarding the proposed service reduction or elimination. It allows the public engagement process to begin prior to providing the notice required in subdivision 1, and it must continue for not less than 30 days following the notice. It requires the hospital to provide a summary of the community's response to the proposal, including the public comments received, to the Agency of Human Services following the conclusion of the public engagement process. Then it directs the Agency of Human Services to analyze each proposed service reduction or elimination for consistency with the statewide healthcare delivery strategic plan once established and the community health needs assessment, to consider the community's response and the impact of the proposal on access to necessary care and services in the hospital service area, and to provide non-binding recommendations on the proposed reduction or elimination to the hospital, the Green Mountain Care Board, and the public. And then if a hospital chooses to go ahead with reducing or eliminating service after completing the process in subsection A, then within 5 business days after making the decision to proceed, the hospital would notify the Agency of Human Services to inform its healthcare system transformation efforts and future versions of the strategic plan, and the Green Mountain Care Board to enable the board to review the impact on the hospital's budget. Section 2 is the hospital budget review statute.
Can I just say one thing? Just so people don't put a great deal of thought into this one part, the dates and the times that we all know, if regardless of where we go forward with this, they've got to change. So don't worry. I wouldn't be doing calendar math before Thursday. That's it. Sorry.
Section 2 is the hospital budget review statute. So again, here's where the existing language is struck. And instead, we have upon notice, a receipt of notification from a hospital, previous section that the hospital intends to reduce or eliminate a service following its completion of the process in subsection A. The board shall review the impact of the reduction or elimination. So this is a shall review on the hospital's approved budget. And then the board may adjust the hospital's budget as necessary to reflect the elimination or reduction, which may include directing that any savings related to the reduction or elimination are returned to Vermonters to address affordability concerns or to payers to be reflected in health insurance premiums or are invested in primary care, prevention, and other community-based services. And then we have some just cleanup language here around reduction or elimination, although I know this is one of the pieces the Green Mountain Care Board suggested deleting entirely, which is this requirement that the board, in collaboration with DFR, monitor implementation of any authorized, and it's not really authorized anymore anyway, reduction or elimination to determine benefits. The act would take effect on passage.
Any questions for Jen on understanding the language?
If you wanted, we could go back even further to the version as introduced, which was arranged a little bit differently and required an affirmative approval requirement from the Agency of Human Services.
I got one right off the bat on page 7.
Yeah.
The hospital that proposes to intentionally reduce or eliminate. Did we take out?
Page 1? You said 7. That's okay.
Oh,
Line 7.
Line 7.
Line 7.
Line 7.
All right. Yes, go ahead.
Okay. We were gonna take out reduce, for some reason or not, did we or no?
I think there was, at least one of your witnesses may have suggested narrowing the scope, so it wasn't just reduction, but only elimination that would trigger the notice requirement.
Okay.
So I think so you have not, I have not been directed to make any changes
Okay.
to what passed the Senate yet,
Okay.
but I expect I will.
Right. Yeah, go ahead.
So I was reading this at one point, wondering if we needed definitions to reduce or eliminate, or, because that seemed kind of vague. I mean, I'm sort of like wondering, what's reduce mean? And then, yeah, I don't know.
I think that was the good point that somebody made of.
Yeah, I mean, I think it all gets
Really,
challenging. I think it sort of requires taking a step back and figuring out what it is what the circumstances are that you think warrant notice and this process, and then focus in on that.
Was there a distinction between, if I may, like the one urologist retires? Is that reduce?
Well, that's where the intentionally comes in,
Okay,
because the point was if
Made
the
him.
hospital is making the decision to intentionally,
well, because they couldn't replace the urologist, so they're,
well, are they trying to, or are they done providing urology? I think that's.
I mean, how do we know?
I think I had it flagged that essentially, what's a service? Like, that we might need to,
Yes, I think it has generally been discussed as far as service lines, but that could be clarified as well.
okay. So that's the bill that came to us. And we've taken a fair amount of testimony on it so far, although I suspect we're gonna do a little bit more. But I really wanted people to think about like what we've heard in testimony and where your thoughts are. I really would like to get the committees.
Is there any reason not to do this?
Well, if this is the way we want to do it, I guess that's what I'm saying is this the way we want to do it? And if it is the way we want to do it, or do we want to just leave it as is? We could just leave it the way it is.
You're saying leave the process that is currently in statute without doing more legislation.
Yes.
High
Do
level,
that.
what's the big difference? Is that just the process of putting it in the paper?
Well, there's the public process in
Public
this.
engagement process, the Agency of Human Services, sort of analysis and recommendation.
Number of days.
But we don't even have that process in place yet, correct?
This would be putting that process.
The bill would be putting that process. That's why we looked at the current statute first to see what is the situation now, and then what does this do that's kind of different from that?
Could you send that current state again so I could just compare?
The current statute?
Yeah.
Yes, it's in the bill with the lines through it. Maybe
Oh, show me, yeah.
you can find it all in one
Oh,
document.
is this 9405?
No, section 2, the struck-through language in section 2.
Page 3, lines
Page
15.
3, page 3, line 15 through,
This is the actual language from.
that is the actual statutory
Okay,
language that would be.
Thank you.
So that way you can, and want to put it up on the screen and go through it struck through because it's harder to read it that way, but.
I like the public outreach on this portion, because as I was reading who was going to be notified, I'm thinking, well, the public should be. And once we get down to it, I'm like, good. Because I know in the past, there have been some hospitals who have stopped maternity, for example. And some people were blindsided by that. So
Let me lay out what I see as options on how to move forward. And we don't need to talk about it now. We're talking about it on Thursday. Options for moving forward is to not do anything and leave it exactly as it is in statute. That's option 1. Option 2. We could put in just this robust public notice sort of thing. We could, option 3, we could insist that AHS makes a decision and tells the Green Mountain Care Board what the decision is. Option 4 is we could not have AHS be a part of it at all, and we could make the Green Mountain Care Board make the decision. Option 5, what was option 5? Yeah, I mean, we could strengthen the bill, we could weaken the bill, we could ignore the bill and just let the situation be as it is right now. Those are basically our 3 options, 3 or 4 options. So go ahead, but I don't really want to do discussion around the bill necessarily, but
The only thing that confuses, I think I'm trying to understand what confuses me, and in the current language, when it says with a budget. So that's what it's like about
Comply with the budget.
comply with a budget, which seems to be different, but maybe I'm misunderstanding about providing services.
that's what the Green Mountain Care Board in their budget of review.
You're looking at the existing language of the statute that says.
Yeah.
A hospital that proposes to reduce or eliminate any service in order to comply with a budget
Yeah,
has to do things. And I think the language in 189, as you're looking at it, is potentially broader than that.
Yeah.
Because it is sort of purpose agnostic, not specifically to comply with a budget, but for any reason.
whatever reason in the world, like someone retires or, whatever.
Well, but again, that's the intentionally piece.
Yeah, I'm getting stuck there, I guess.
Yes, I'll pull.
Yeah.
Kevin, if you want to talk
So
about that.
I thought comply with a budget to me is a narrow, which is current statute.
Yeah, last year it was if they were making decisions to comply with their budget orders.
Right.
That's where that kind of came from.
But that's not what happened. I'm just trying to understand, I'm sorry. That's not what happened when, the primary care practice was closed in weeks. Wasn't to comply with the budget order.
I mean, sometimes it depends who you ask.
Well, okay. Got it.
So, which may honestly be a reason not to tie it specifically to that language. If you can argue, that most decisions both are and are not for purposes of complying with a budget.
I'm not the only hot
added-
person in here because I'm dying.
Might have, added additional complexity that wasn't.
So I appreciate that because I got a little stuck on that budget word. There are other reasons to do it.
Since you're stuck on that word, then you're advocating, I can tell already, to strike it out.
I think it's struck out in the new, in
Yeah,
the
that's what I
189 anyway.
Yeah.
So I did say we could just take this and we could
Well,
just.
it's choice one, and so I want to understand if we do choice
So we've
one.
got several choices
Yeah.
ahead of us, and I'm really just trying to get a feeling from the committee what options they want.
Last question, but
Yes.
do we have enough information and hearing from people as to how important it is to have a final arbiter and which arbiter that should be?
I want to have this really robust discussion so that we can all decide who else and do we want to talk to, need to talk to again to make the decisions but I want to, before we have more testimony on it, I really want to get a sense from the committee where they want to go with it, because frankly, I don't want to, waste more time and our witnesses' time, if it's something that we're not even going to do anyways. So, all right, we're going to take a break. We're going to be back here at, let's say, can we come back at 10 minutes till 3? And I know we have Dr. Leffler at 3, but let's come back and maybe have some committee discussion before that. All right, we'll be back at 10 of 3. We can go off the mic.